Does metformin cause weight loss? So this is a question I get a lot. Does the drug, the diabetes medication or the pre-diabetic medication called metformin, does that cause weight loss? Yes, it certainly does. And I've covered it in a lot of my topics, but so do other drugs like ACE inhibitors, like your lisinoprils and whatnot, and amiodarone even. There's a lot of medications that we use for other things that have as a side effect weight loss, but the most pronounced one is probably metformin. It's a diabetes medication, and it does cause weight loss depending on the person, anywhere from 5 pounds up to maybe 15 pounds. Now, does everyone we put on metformin lose weight? No, and we don't put people on it because they need to lose weight. We put people on it because they have a blood sugar problem. It's cardioprotective, and a lot of people say that it has some longevity benefits, assuming you're doing everything else right. Metformin is one of the few drugs that if we put people on it 20 years ago and they were only on it for a short period of time, 20 years later we found that they're less insulin resistant and less likely to have type 2 diabetes. Now, it works in about 4 different ways. The first way is that it blocks some of your carbohydrate absorption. It prevents your liver gluconeogenesis, prevents the liver from making more sugars. It sensitizes you to insulin. It like your body, your muscles and tissues that require insulin to function, it sensitizes them better so the insulin you're making now works more efficiently or better. And it reduces insulin resistance in muscles and other tissues. So that your muscles, like let's say your body muscle, your skeletal muscle, is better able to use the insulin that your body's already creating. There's a few other mechanisms that we don't understand, but it definitely can work. Now, should you go to your doctor and say, hey doc, I want to try metformin just for obesity? No, but if your triglycerides are high and your fasting glucose is a little out of range, you're pre-diabetic, yeah, sure, you can do that. But also don't forget, like I always talk about with weight loss medications, use it as a tool to help you, but if you don't dial in your portions and your nutrition and start focusing on actually losing weight without the medicine, it's going to be hard long term, because we have found also that people who are on these medications long term do eventually revert back to their original weight. So yeah, you may lose 5, 10, 15% of your body weight initially, but then we find that will come back if you don't watch it, or if you're not cognizant of it and trying to actually lose weight. So grab some of my stuff below. I have a book all about this, but hopefully you learned something. Please share this with somebody who needs to hear it.